Hi, I'm Dr. Raymond Adams here with the Florida Anti-Aging Center. We're here at an informational conference on breast cancer prevention, and we're live on Facebook. And this is audience participation, so that if you have any ideas, I want to hear from you, and also from Facebook. If you send in, the answers, because there's going to be a quiz here to see how much you know. So breast cancer, obviously, like a very serious condition. The most cases of any kind of breast cancer. Not the most deaths, because some people manage to survive breast cancer, although they get the most cases of anything else. And so then we're going to talk about what are the things that can increase the risk for breast cancer, and what are the things that could decrease your risk for breast cancer. So we're going to have a little bit of a contest here, including people on Facebook there, that we're going to try to come up with the 10 things that could potentially contribute to it. So suppose you got a friend on Facebook there, and they're saying, I'm worried I might have breast cancer, but you never know this person. What would you ask them? Well, do you have this? What were the things that you might want to know about them to find out if they were at risk for breast cancer? And there's a prize. Whoever gets the top one gets a bottle of champagne or a bottle of red juice for that. Any ideas? Now there's 10 choices there. Then who can guess like the most common or the most important? Now I'm looking at the most common, the one that really is kills the most people. What is the risk factor that kills the most people that can cause breast cancer?
Hereditary?
Hereditary, so like a family type history then, is that what you said? Well, yes, that is on the list. So we have one on the list over there. We have family history of that. And it actually is a fairly strong risk factor, that if you have one first degree relative with breast cancer, then it puts you in a double risk. Well, double risk, it's pretty high. So if you're asking that person, you got someone family with breast cancer, well, no, that's kind of bad. So what else could we have on there that might possibly increase their risk?
Postmenopausal.
Postmenopausal, that's a good one. Being postmenopausal in that they don't have hormones then, correct? Well, that is kind of on the list, but in an indirect way here, because age is directly related to it. And well, I find this one of the most fascinating charts altogether, because over here there's almost none, and then almost none, and now women are starting to go through menopause, and now they're mostly through menopause, or not through, but they're suffering from great deficiencies, and now it just goes up and up and up. So it seems to correlate, well, they got estrogen here, they start losing estrogen, they lose more estrogen, they're out of estrogen for a long time. So to me, it correlates very well with estrogen depletion on that. There's another possible theory. It could be just like degeneration with time. Stuff is just breaking down, there's sugar and inflammation kind of going on, and all that stuff starts to add up. So I think it's maybe a combination of the two, but these women down over here, they have, for example, a family history, but they're still not getting breast cancer yet. Right? They're going to have some protection. Another one, anybody? And by the way, that's the number one, is that age is the number one risk factor, and may be related to estrogen, lack of hormones.
Low vitamin D, alcohol intake,
Weight.
someone's done the research.
Okay. All right, so let's go through that. So now, don't shoot the messenger, right? Because some of these things are going to involve changes in lifestyles, So alcohol definitely, increases your risk on that. And what did you also say?
Low vitamin D.
Yeah, well, that comes more into like prevention, right? So we'll come to that in a little bit.
Weight.
But weight, yes, somebody said weight. Well, the breast is a fatty tissue, So if you have a lot more fatty tissue, well, you're more likely to develop a problem with fatty tissue. And as it turns out, that breast cancer is the number one weight-related cancer. There's breast cancer over here. This is how many cases of it is. And other weight-related cases, your uterine, your kidney, colon. But if you're looking at cancers that are related to weight, breast cancer is the number one related to weight. Which maybe goes into some other things.
Hormone decline.
Hormone decline. Well, we kind of think covered that on the first one there. But
Okay.
anything else, lifestyle-wise or diet-wise, or?
Diabetes.
Right, so maybe sugar-related, right? Then maybe if you eat too much sugar and carb-related stuff, then maybe that aggravates the problem, and it turns out that that is the case. Where's my chart on that one? No. Well, I gave it away there. Smoking is another one,
Oh,
right?
yeah.
Right. Smoking increases your risk, and then diet. These foods. Processed foods, these things contain nitrosamines. So things like bacon, ham, other cold cuts, salami, these are carcinogenic for all cancers, but especially for breast cancer. And I hate to tell you, but red meats also, I love red meats, but they are carcinogenic, and more specifically also for breast cancer. And there's some others that people have missed you. So what does our Facebook people say? We got any suggestions from Facebook people?
No, I have a few people watching.
Okay. One is actually fiber can actually relate to this too, that if you're eating processed foods, you're not getting some whole fiber that can actually kind of increase your tendency towards it. But really like a high sugar diet, I don't know if I lost this slide on that one there, but a high sugar diet, can also do it. Processed sugars and such like that. And there's also one that people have not mentioned here, is genetics. There are people that have this BRCA gene. Look at that, 50 to 65% risk of breast cancer with this one, 45 to 50%. Like, that's really huge. But fortunately, only about 5% of people, have this type of gene there. So that's why it's not the number one cause, is because most people don't have it. But if you have it, it's bad news. And then, so this is the genetics of it. And there's other genetic forms like this one, these other genetic forms over there, but they only account for about 5 to 10% of breast cancers. And then there's also radiations. Now, it's not the radiation that you get from a mammogram, because that's relatively small, but people have had radiation treatment for breast cancer, for hair, nose, and throat cancer, or some other kind of lung cancer, they're at higher risk for developing breast cancer. So those are all the main cause. We caused the main 10 of them. And so then, but circling back to this one over here, these people over here, they've got BRCA, they've got a family history, they may smoke, they may drink, they may eat too much sugar, but they don't get breast cancer. Right?
Yeah.
Right?
Yeah.
So they're young and they got hormones, but as soon as the hormones start to go, here comes breast cancer. So, well, now you got a pretty good idea. Well, don't get fat, don't eat too much of the wrong fats, don't eat too much of the wrong sugars, try to get some fiber in there, stay out of the radiation. So now what could you do possibly to get away from breast cancer? Wait, there's one more thing, we mentioned this. This is the most important one that in people's minds. Things that cause breast cancer. What are we leaving out?
Hormones.
Hormones.
Yeah.
Exactly, right? And this is maybe the most important part of the whole conference, is because the World Health Initiative started in 1997. I was part of that. And they tested women starting at 65. When does menopause occur? At 45, 50, 55, 20 years late for some women. Now, I was treating women at those phase, and 65-year-old women don't want to take a pill. They go, I don't have any hot flashes, As far as they knew that, well, my brain's fine, my energy's fine. They didn't see any kind of hormone deficiencies, so they didn't want to take the treatment to begin with. And the idea was we would give them Premarin, which is a horse estrogen, come from horse urine, and Provera, which is a chemically altered progesterone kind of form, by mouth. So it would go through the liver and through the intestines. And at that time I was practicing, I thought, well, giving estrogen to women seems logical. Giving progesterone to women seems logical. Seemed logical that would help for conditions like osteoporosis, for example, and maybe mood and energy. So I was prescribing that. And then all of a sudden in 2002, 5 years later, after the study started, they go, oh my God, people are dying from this. Let's stop it. And we didn't know why. The studies hadn't been done. But the Lord came out, estrogen and progesterone, they're bad stuff. They cause cancer, they cause cardiovascular disease, they cause strokes. And it wasn't until about 2 years later that they said, wait a second, the pregnant group, actually, they didn't get breast cancer. Even though they got an estrogen, like they did not get breast cancer. But this is where women got the idea, if you get an estrogen, you get breast cancer. But it was never proven, but it turned out that Provera causes breast cancer. And the Premarin, if you take an estrogen by mouth and it goes through the liver, it creates sugar imbalances and inflammatory changes, and it can increase diabetes risk and increase clotting type risk. So it turns out taking it by mouth is not the best route. So the root of it and the age of the people and the medicines that they choose, which are not bioidentical, cause great harm. This is, I think, maybe the worst thing that medicine has done in our lifetime or in any lifetime, worse than bleeding, right? Because here's what happened, right? Now the end result was they found out that really it was the progesterone component that caused the cancers, and it was actually minuscule. It was from 3 per thousand to 3.8 per thousand, 26% increase. Well, I don't want to give you anything that increases your risk for breast cancer, but it wasn't like it went from 3 to 1,000. You know, it went up a little bit. And the estrogen, they actually got more strokes and heart attacks and stuff from that because of the administration route that they had. So, but this scared women completely from taking estrogen. And when they finally, but there has never been a study to show that estrogen increases breast cancer risk. Now, if I can show you some information that actually it decreases breast cancer risk, but this is the penalty of medicine. The fallout from, they dropped the bomb on you. Because between just even these 10 years, they estimate 96,000 women died prematurely from not having estrogen. In those 10-year time period. Hiroshima killed 70,000 people, Nagasaki 50,000. This is 91,000 women are killed from lack of estrogen. And people are still saying that, oh, estrogen causes breast cancer. Mm-hmm. Don't take estrogen, right? And they're completely wrong. We dropped the bomb on you. So again, it's just the risk factors, alcohol.
Yeah, that's not bad.
Yeah. So now what can you do to reduce breast cancer? There's 4 real main things that we're looking at over here. You know, you had one on like vitamin D was one of the things. Anybody have diet, right?
Diet.
And what about diet?
You need to eat healthier. Just
Yeah, in what way?
stay away from the red meats and
But how can
Processed meat.
But that's what you can do. What can you do to decrease it? Not increases it, but to decrease it, what do you do?
vegetables.
Maintain a healthy weight.
We're getting closer here. So, cruciferous vegetables. These are your best cancer protective nutrients, especially for breast cancer, but also for other forms of cancers. You know, broccoli, cauliflower, gale, arugula. That's what you saw in front over there. You know, all those foods, right? So these actually decrease significantly breast cancer reduction. But also, strangely enough, tomatoes. You know, tomatoes actually also effective for decreasing breast cancer production. But also, like you said, just eating healthy. Breast fruits, vegetables, you know, just mixed together can greatly decrease your breast cancer risk, plus other risk. But also supplements, you kind of alluded to supplements. Vitamin D can actually decrease it, but how much? How much vitamin D do you want? How much do you take? Right, you know, it's important, right? Because most women, to be honest with you, start with the lowest dose. I'll just take 2,000 because I don't want to be, you know, take too much.
Yeah, what if I take too much?
Yeah, but really most women need 5,000 or sometimes even more. And you want to shoot for a level at least 40 to 60. Now, normal vitamin D level is up to 30. That's not sufficient. 31, 32, 35, not sufficient for breast cancer protection. At least 40, ideally closer to around 60 for the optimal breast cancer protection. There's other nutrients, vitamin C, 1,000 milligrams. Selenium, great cancer protective nutrient. Vitamin E, you need especially the gamma E, which Life Extension makes because there's 6 forms of vitamin E. This is the cancer protective form of vitamin E. Don't take regular vitamin E. The gamma vitamin E is what you want. Green tea or the extract, also helpful. And quercetin, which is an apple or a grape extract, also helpful for breast cancer protection. And what else? What else can you do? Now hormones on this side. There was hormones on the other side, the bad hormones and not bioidentical like Premarin and Provera. Now on this side, for decreasing, there's hormones on this side also. But these are bioidentical. So there's a number of studies here. There was a Dayton study where they looked at 2,000 patients or more for 10 years. Now these ones were treated with testosterone, not with estrogen. But testosterone is cancer protective. And so that in this study, they saw 39% less breast cancer. So women, they get testosterone just like men do, and they develop deficiencies, and the deficiencies cause the same symptoms that men do, decline in fatigue, energy, mood, sleep, libido, brain function, and replacing it helps with decrease, breast cancer plus other illnesses, which we'll come to. And then there was the BioT study, which we use BioT pellets here. And again, they had 2,000 patients for 10 years. And so these women did get estrogen, and they had a 35% reduction in breast cancer using a combination of testosterone and estrogen. So significantly improvement, and plus improvement in quality of life. But not only does it help protect against breast cancer, but also against dementia. And it turns out the woman's brain is critically dependent upon estradiol for function. And then you get this phase where they start having all these symptoms of hot flashes as the estrogen is declining. And at that time, when they go through the change, the brain starts to decline fairly rapidly without estrogen. But with estrogen, the brain function is maintained, and so you don't get that rapid decline headed towards Alzheimer's disease. You're 68% less likely to get Alzheimer's disease if you have hormone replacement therapy. Now, others is this for diabetes protection. Now, this is estrogen and testosterone improve blood sugar metabolism, particularly testosterone. This study honestly was done mostly in men, but they were able to reverse diabetes to prediabetes and prediabetes to normal, using testosterone. I see similar results in women, that it helps to improve their blood sugar metabolism. Unfortunately, the research has not been done on women. Women have been neglected in many ways, in terms of their medical care. But there's good evidence that improves blood sugar metabolism. And also in cardiovascular health, there was a study that they did, they gave estradiol to women, and they found that they had less heart attacks, they had less congestive heart failure, and they lived longer. They had mortality benefits in women that got just solely estrogen. So there's good evidence that it decreases breast cancer, osteoporosis, diabetes, cardiovascular disease, and premature mortality. And not to mention the quality of life improvements that you get. So not to forget, I do recommend still that you do get mammograms on a regular basis. Early diagnosis helps us keep the number of mortality cases low. We still get more cases, but a lot less mortality. We get diagnosis early. And so a conclusion that the things that cause it is very complex. That improvements in lifestyle, in diet, in supplements, in hormones can greatly reduce your risk for breast cancer, but also for things like osteoporosis, diabetes, cardiovascular disease, dementia, and early mortality. All right. So, any questions on that? All right.
Back a few slides. Was that the BioTE study that you were showing?
It was, yes.
Okay, that's the results of
Yeah,
that.
and I have actually references on that. If you want the reference on any of these,
Okay.
I have the references on those. But yeah, so 2,000 patients or so for over 10 years, and they got testosterone plus estrogen, and 35% reduction in breast cancer with that combination.
And that was done in the United States, of course.
Yes.
Okay.
What about men? There's a very limited, men do get breast
You can. There's about
cancer.
1 or 2% of cases are with breast cancer. I'm not really sure. I mean, I think a lot of the same factors are involved. That
Right.
if they eat the wrong foods, if they smoke, if they drink, if they get overweight, they're still going to get it. They may have some things, but so the point I want to point on this one is these women down over here, they've got BRCA, they eat fatty foods, they smoke, they drink, but they don't get breast cancer. right. So to
You're
me,
probably eating much better there
yeah,
too.
yeah. So to me, it correlates. If you look at estrogen level and this, it's almost like an inverse. You know, here you got lots of estrogen. No, here they got not less estrogen, and the less estrogen they get, the more cancer they get.
I mean,
Interesting.
dementia.
Yeah,
And then we've been told the opposite.
yeah, that's right. Because of that study,
Yes.
right? That stopped millions of women from taking estrogen because for 2 years they didn't know. Was it the estrogen? Was it the progesterone? What caused the problem? And the media never corrected it. Even though the media tried to say, oh, well, we changed the results of the study. Yeah, well, nobody heard that.
No.
Everybody
No.
still heard what was said in 2002. It's been propagated from person to person to person with no evidence to support it.
Mm.
You know, just a misconception that was brought out. Our fault. We gave you the wrong stuff. We made you sick, and then we didn't give you the right reason why we made you sick. We confused you with the answer.
Right. Because I can
It's
honestly say, like, since I started going through the change, I've never, ever, ever been considered pre-diabetic. My A1C has always been great. Just went a few months ago, pre-diabetic now. A1C is
Right.
5.9.
Wow.
Oh yeah.
Yeah.
And because my estrogen is starting to
There
decline,
you go.
my A1C is going up.
That's right. Right.
So yeah. Oh yeah. So
It
yeah.
makes you go,
Yeah,
Seriously,
absolutely.
'cause it's like, you're
Yes.
getting older, but you don't want to feel like you're old.
Yeah.
You want to still
Right.
feel good
Absolutely.
and do the things, you know?
Mhm.
So,
Yeah. Yeah, no, it all makes sense. It really does.
It's just that the public doesn't know that. You know, they're still stuck in 2002. That's the problem. I never thought when I did that, participated in that study, that we talking about that 25 years later, we still be, you know, and people, it's still in people's mind. They still be believing what they heard in 2002, and they've never changed their mind since then. But that's
No.
the majority of women out there are believing in 2002.
Yeah.
Yep, you're gonna
Yeah.
get old,
Yeah.
you're gonna lose your mind, and you're just gonna go.
Yeah, they're accepting of that, but it doesn't have to be. You know, we don't have to lose our mind. We don't have to get fat. We don't have to lose our bones and our muscles and shrivel up. You know, we can hold off that process.
Right. No,
Lots of people need to know
completely
about
makes sense
that.
to me.
Okay. All right. Any other questions or
Do you,
comments?
do you know if any of this is being incorporated in medical school now for?
No, it is
No,
not.
not
No.
yet.
My son just went through physician assistant training. I help people go through medical
They're
training.
still- it's
They're
there
not
yet.
teaching this stuff here. You know.
But it's still very early. Well, in 21 is when 2021 was that study, but it was done by the company that.
That did that, right.
Right.
It's not, medical doctors just learning what they get fed in these conferences that feed the same stuff that they fed them before. They're not researching the internet, not looking at alternative sources, not integrating all this new information that's just exploded since the internet, you know. I couldn't have done this 20 years ago. I couldn't have made this conference there because you couldn't search the internet. I'd have to go to the library, ask for and request a periodic to be sent to me so I can make some copies of it and then maybe get some information out of it. It was a very slow process to put this information together, but now you can put this all together. I did a lot of this information through AI, to be honest with you. Did some research through AI to put all this information together, which is obviously not available.
But you think more people would be interested with all the stuff they have out there that they can look at now with the internet and stuff,
They could,
you know?
but they just want the quick, easy entertainment, you know, like the
Quick
TikTok, there's a 5 minute, 1 minute, boop, that's funny, or
Yeah.
30 seconds, that's funny, you know, but they don't want to make their brains work too hard.
It's like instant gratification world
Yeah.
now.
Mhm.
Yeah.
Yes.
Very interesting.
Thank you.
All right,
Yeah.
Yeah.
new stuff for our office.
Yeah, just building back up with you.
Did you shut this off over here, Joe? Low battery, but still working. 24 minutes, not too bad.